So we will go on with two presentations with experiences from countries. And the first one is by Professor Gunnar Skov Simonsen, who's the head of department for Norwegian Organization for Surveillance of Antimicrobial Resistance. He's based in the University Hospital of Tromsø in northern Norway. And he will present the Norwegian experience with having a One Health approach to respond to antimicrobial resistance.
So do I get the, okay, thank you. So thank you for the invitation. It's my first trip to Belgrade and to these parts of the world, so I'm very happy to be here. A little bit about my background. I'm a clinical microbiologist, so I'm a doctor working in a hospital. Then I also do a lot of surveillance work. I have a part-time position at the Norwegian Institute of Public Health. I should also say that when it comes to AMR, I've been working a lot with Dominique and the surveillance people in Europe. But I also have quite a bit of experience working in northwestern Russia and in several countries in Africa in very resource-limited settings, trying to set up AMR activities. So that'll probably come into my views as well. I have put up Anne Margrethe Urdal as a co-author because many of the slides I've borrowed from her. She's in charge of the Norwegian Surveillance Program for Antimicrobial Resistance in Animals. And we work very closely together. But all the views and opinions here will be my own. So the outline here will be, I'll tell you a little bit about the background, about health and agri and aquaculture in Norway, just so you can understand the setting, because it's somewhat different from what you're used to. A little bit about surveillance, national strategy, action plans and targets. Of course, I'll focus on integrated One Health actions, where we have some interesting experiences. AMR in environment is relevant, risk assessments, and at the end I'll say some words about stakeholder involvement and communication, which is key to how to deal with this issue. So this is just to give you the backdrop. I live up here, so you can see right there at the top, so going to Belgrade is quite a journey for me. Norway's got 5.3 million inhabitants. It's a fairly large country, not very densely populated. Everybody will say that we're dirty rich, and that's because of the oil. In addition, of course, we have fish, industry and services, and we have an aging population, as you may well be aware of. When it comes to agriculture, we are not really an agricultural country. So traditional agriculture is somewhat a closed system. We don't have a lot of import or export, which has a lot of benefits when it comes to controlling AMR. So these are just the numbers. We put them into a yearly report, so for all readers should be aware of what kind of country they are really looking at. But on the other side, you can see here, these are the figures which we also put in the report about our production in aquaculture. So like for instance, Atlantic salmon, we produce some 1.2 million tons a year. So from a food producing perspective, we are much more of a fish nation than a traditional agricultural nation. When we then turn to AMR, you have all seen all these maps, here exemplified by EARSnet maps for VRE, MRSA, ESBL E. coli, and carbapenemase-resistant Klebsiella. And invariably, you will see that Norway will turn up something like green or light green, and in the most extreme, a little bit yellow for ESBLs. So why do we worry about this? Well, there are two reasons why we worry about this. One is the one to the left, which indicates the proportion of ESBL production in E. coli and Klebsiella in urine and in blood culture samples. So even in our corner of the world, we realize that things are heading in the wrong direction. We are now at 6 or 7% ESBL production. And from our point of view, even though it's lower than in many other countries, to us it's a clear sign that we need to work hard on this issue. To the right, you also can see the distribution of the different carbapenemase-producing Enterobacteriaceae coming into Norway. There are still just a number of isolates, so it's a fairly limited problem. But we are, of course, not an island. We are also exposed to what goes on in the rest of the world. However, it should be said that we have a very strong belief that it matters what we are doing. Even if bacteria it's often said that bacteria do not know borders, but MRSA apparently knows the border between Belgium and the Netherlands, because there has been a 20% gradient there as long as we have monitored it. So on one hand, we need to take into account the migration and movement and the mobility of resistance. On the other hand, we should be quite clear that what you do at the local level is important for what the situation will be like in your end. I'll not give you a lot of results about AMR in animals and foods, just an example here that we do actually have a lot of surveillance both of animals and feed and food. And we also produce them in this joint report, which I will come back to. When it comes to antimicrobial usage in food-producing animals in Norway, it is extremely low. It's extremely low. And there are several reasons for that. One is that, of course, we do have a very decentralized agriculture. We don't have kind of industrial production as such. Some of the species we are rearing actually live up in the mountains much of the year. Like lamb production in Norway, it takes place out in the wilderness where they don't get any medication. And so by and large, and to the extent that we use antibiotics in animals, it will be fairly conservative choices. We use old-fashioned penicillin. And often when I go to countries with limited resources, I often point out that if you're able to control resistance, you can use cheaper antibiotics. So like in Norway, we use extremely cheap antibiotics. We don't worry about all these fancy, expensive preparations. And I think for a lot of countries, that would be a good argument. A final word on aquaculture. Previously, that was a huge driver for antibiotic use. In the late 1980s, we used in raw kilograms approximately as much antibiotics for fish as we did for humans. But that was solved during the late 80s and early 90s through the development of vaccines, fish vaccines. So even though the green line here demonstrates the production of salmon, the actual usage of antimicrobials in salmon production has fallen to a very, very low level. Okay, the One Health approach. This is the report we issue every year. The year here is the year the data come from, so it's actually the 2018 report. I brought a stack of them, so you're welcome to have one to bring home if you want to have a closer look at it. And I just want to point out that what we have done, and we've done this for now almost 20 years, is that we make a report where we put together, let me see if I can have a pointer here. We put together here usage in animals and in humans, and then we look at occurrence of resistance in animals, in food, in the zoonotic bacteria, and then in the human samples. So even though it's not kind of totally integrated, we try to put together the different sources from these surveillance systems in a way to encourage the reader to understand the links between them. We don't do these very advanced analysis on an ongoing basis because that will simply be too burdensome. But we do present data for everybody to use and read. Okay, our first national strategy was issued in the year 2000, so that's a long time ago, and we've had them on and off, and we're now having a national strategy against AMR from the years 2015 to 2020. This is at the government level, so that is overarching all ministries, and the overarching goals are to reduce total use, improved knowledge of drivers for the development and spread, and also emphasizing a international commitment. Then, if you look at the kind of the more operational level, I realize it's quite small here. I go through some of the main points here. But the idea here is that you have basically 4 different ministries with a dedicated responsibility in the AMR area. So here you have the Ministry for Healthcare and Services, where I have my daily work, but then you have Agriculture and Food, you have Ministry for Trade, Industry and Fisheries, and you have the Ministry for Climate and Environment. So all these different areas have their specific obligations, and you have a working group at the ministerial level, which does not contain any experts, but it's kind of the political anchor for the activity. The coordinating mechanism is at the kind of the expert level. So that's where I come in and several of my colleagues, where we look at kind of the practicalities of what we want to do. But these people at the ministerial level are extremely important because they provide us with the kind of the political cover for what we want to do. I will not go into detail about, there's too much to look at, but I will not go into detail about what we do in healthcare, but suffice it to say that we have set very specific targets on reductions in the use of antibiotics, and they're quite ambitious. So from 2012 till 2020, we shall reduce the overall consumption in humans by 30%, and we will get there. And we are even starting from a fairly low level. I mean, we were in the kind of a far down in the lower half when we started, but the target was set on the basis of what is seen in Holland. So basically, if the Dutch can live with it, the Norwegians can probably live with it as well. So we have a lot of activities there. In hospitals, we have a similar target. We say that we want to reduce the consumption of selected broad-spectrum antibiotics by 30% from 2012 to 2020. It's ambitious. I hope we'll get there, but it will be a challenge. If we turn to the veterinary side, they have a specific action plan under this overarching strategy. So we don't have a joint action plan. We have a joint strategy, and then the different ministries will have their action plans, how they can deliver on their targets. So I'll just briefly look at what the targets are on the veterinary side. So for the food-producing animals, including horses, there should be a 10% reduction of veterinary medicinal products from 2013 until 2020. And as you can see here, indicated by depending on how you measure it, in raw kilos or in milligrams per production correction unit, we are actually almost there by the end of 17, and we will be there in 18. It should be said, though, that there has been a slow decline over many years of consumption in food-producing animals. So it was actually, at least to me, it was a bit of a surprise that they were able to reduce further. When it comes to companion animals, there should be a 30% reduction, 2013 to 20. It's also moving down. I see the colors are not too good here. We have a little bit maybe of leakage here related to use of human preparations, but we believe that to be fairly under control, so we will get on target there. Let me see. I think I skipped one here. We had a big thing related to the use of coccidiostats, which are used in poultry production, narasin, primarily in Norway. And that was decided that should be phased out by 2020. But as you can see, it has actually dropped off much more rapidly than that for reasons I will explain a little bit later. And then finally, in aquaculture, it was simply stated that we should stay below the level, which was the average level between 2004 and 2014. And even though it goes a little bit up and down, we are well below that threshold. So, the point is not what these targets are. The point here is that the mechanism of setting targets has been actually quite successful in our context. So to have a firm government commitment to a plan, setting specific targets, and then that's a common goal for everybody to work along, has actually worked pretty well. And that is irrespective of whether it's in human sector or in animal sector. Then we have some specific target areas where the One Health dimension has been especially highlighted. And I would pull out the example of the MRSA, the animal-associated MRSA. We have had several outbreaks and transmissions of these MRSA in Norwegian pig industry. But as opposed to Denmark, where the pig industry is very, very big and very integrated internationally, it's much more kind of a secluded system in Norway. And that has led to establishing the principle that we will actually eradicate it. So there's a control system, and every time a case is notified, there is a kind of an outbreak investigation, and then these farms the animals are exterminated. So it's a stamping out strategy, and I realize that may not apply to many other countries, but at least in Norway it has been seen as successful. In our context, for speaking about One Health, it has been a very successful project because veterinarians and food scientists and people from the Public Health Institute have worked very closely together to establish and enforce this strategy. So that has kind of been a positive experience. When it comes to AMR and environment, that is what I call the unknown unknowns. We don't really know what's out there, and very few countries have done a lot on really environmental surveying. In Norway, the Veterinary Institute, they have a lot of surveys related to animal health in wild living species, and they have, over many years, have they taken in AMR as one component of their work there. So we have here on red foxes, on deer, on reindeer, and on mussels. So when they work in different contexts with different surveys on toxicology or what have you, there will always be something on AMR. We don't find much, and that's not a good thing. You could ask whether it's a reasonable use of resources, but anyway, it kind of plays into this One Health context that we should look in a broader sense at the issue. Risk assessment has turned out to be a very important part of this, because the world is, I'll almost say, full of microbiologists who can say that, well, we have something resistance here, and we have something in the hospital, and we have a problem. But what the decision makers want is really to have a risk assessment. They want to say, what is the real significance of this? So we will put a lot of effort, and again, a collaborative effort between human medicine, public health, veterinarians, to make risk assessments of what do these different transmission lines mean. And these are available on the internet. You can have a look at them, and they all have a summary in English. Stakeholder involvement has been extremely important for the Norwegian setting. And this is just, I got it from Kari the other day, this from the Nordic Veterinary meeting in 1962, where they say we veterinarians must reach the truly responsible use of antimicrobials. So we have a long history of some key stakeholders engaging in this question. I mean, this is before the Swan report was issued. So it's kind of easy to come along with this topic when the audience is so perceptive to the messages you present. We have had some areas where we feel that we have had some element of success in the One Health work together with stakeholders. The antibiotic use in aquaculture already mentioned. Avoparcin use and coccidiostatis poultry was very successful, and also an area where the stakeholders, the animal owners themselves, actually abolished use before the government required them to. So the industry has been proactive because they saw that this was kind of a winning point to be proactive. MRSA in swine has, of course, it's a point of contention when you have all this, if you need to stamp out, but still it has been successful. And then in the most recent years we have this issue of ESBL and AMP-C production in chicken. But you can see down here at the corner, you can see that here is actually the livestock industry's own action plan on AMR. So I think that's a take-home message, to engage with stakeholders and try to make them part of the solution and not to see them as part of the problem. However, just as an example, communication you must be really aware of communication issues when working in this field, because you can very easily antagonize people who are make their living from agriculture if you kind of end up with imprecise assumption. Here we had this debacle, what do you call it, on chicken, where especially this one, where the president of the Norwegian Medical Association said that I have not eaten chicken all autumn, and the sales dropped for many reasons. But again, to have a respectful dialogue between different sectors of society is very important if you want to make an impact. So finally, how to get started, lessons learned. I think it's important to start small, but to think big. So you can just have nice goals and visions for the future, but start with relatively focused and concrete projects. I advise you to set specific and measurable targets, because then you know, if you know what you want to achieve, and especially if you then can achieve it, it will kind of fuel your activity in a good way. You need a combination, in my view, of top-down and bottom-up approaches. We have heard a lot about EU and ECDC activities. That's typically coming in at the government level. At the same time, you need to work among professionals, the general public, consumers. You need to kind of make a combination of these activities coming from both directions if you want to make any change. Strong collaboration on specific activities is very good. Have projects together. Try to sit down, figure out what you want to do in your country, and try to start there, because then you get to know each other, and you can kind of build trust and have a good collaboration. And joint reporting is what I see as a low-hanging fruit. Even if you don't integrate too much, just to write a report together will kind of familiarize yourself with each other, and you can take it from there. Build trust among stakeholders, and coordinate messaging and communication strategies to avoid conflict. And in Norway, we have a joint launch of the yearly report where the people from the veterinary and animal and the food side, together with me from the human side, will present this to our government agencies, and we do it together with cameras and the press and what have you, in a kind of a joint presentation. So that's a little bit about Norway, and I'm happy to take any questions. And if you would, I would encourage you to come and pick up a Norwegian report if you want one, and please don't want to carry them back home because it's a long way. Thank you.
Thank you, Gunnar. I can't help noticing that's the second country that says we sit around the table and we produce a report every year. Very few EU member states actually do this. Well, we'll have another example from Croatia. But the Netherlands produces a report every year in a One Health perspective. Denmark does it. Norway, Austria, very few. But they were good pupils among the EU member states and the EEA countries. So I think it's a good point for you to reflect. It's exactly what you say. We have to sit around the table, you have to understand each other, you learn by producing, and then the first report is not very good. Retrospectively, you don't want to look at it, but then the second report is better, and the third report is better.
And maybe in the beginning it will not be yearly, but biannually, and then you can improve after a while. So again, start small, but you can look into the future where you want to go, but don't get frustrated by some examples which you cannot kind of follow immediately. It's a long road.
So, we've had...
We have a question.
Oh.
Thank you, Gunnar, for your presentation. I have a couple of comments in terms of what actually have worked or what has been important in Norway, and that is that the livestock industry has been so committed to on use and rational use, and that they have been doing together with specialists in the various animal diseases at the Veterinary Institute, and so it has been focused on use. Rational use, as I said, and in order to get down the consumption. And I think actually that is what is extraordinary with Norway, that we very early worked with the industry. And in fact, they were those that took initiative in 1995 in order to set the target. So I really would acknowledge both the veterinarians and the veterinarians in the livestock industry for what they have been doing. Another comment I would like to give is about environment. That has been a lot of confusion. This word environment is used everywhere and in every context in meetings like this. We are an environment. Everything is an environment. And luckily, in 2018, FAO and WHO published a scientific opinion, or I'm not sure about which term to use, about what priorities should be done in terms of the environment. And because you can do everything, but what is the most important? And they ended up with first of thing they could manage. And that was about sewage, clean sewage, and also about industry, pharmaceutical industry, how to avoid that it get into the environment. With regard to surveillance of AMR, they were very clear about it was crop and plants, and the environment around aquaculture facilities. And that is huge, because that is the only thing they, by scientific proof, could say would have an impact. And to start now, when we know that, and in my experience is that the scientific opinion of WHO usually are standing for a really long time. So if you start anything about the environment, I would recommend you, not as EMA, but as Norway, to look into that in order to avoid doing things that doesn't actually have any impact on human health or, yeah. Thank you.
Thank you very much for those additional comments, and I'd like to offer my personal thanks also to Gunnar and for that inspirational presentation, which I think just for me is when you get a country which already has some of the lowest levels of resistant infection in the world, it's very inspirational to see how you wish to go much further, because you see that it is actually good for farming, good for the health system, and because that's the way to keep the threats that you characterized at bay. So thank you very much indeed for that. And now we turn to our third and last presentation on the challenges and achievements of a One Health approach to respond to AMR, and this time from the closest neighbour to the Western Balkans, to Croatia. And it's my pleasure to introduce Dr. Gordon Kompes to describe it. Over to you.
Now I'm in double worry. First of all, it's after lunch, and second of all, I have to speak after Norwegian experience, so that's an excellent, and okay, but we'll start slowly, so there is no problems. My name is Gordon Kompes. I'm working in Laboratory for Bacteriology in Croatian Veterinary Institute, so I'm from agricultural health. But in this presentation, I gathered some information about human health side, so it will be some compilation of agriculture and human health in Croatia, how we doing AMR, how we reporting data, and how we have intersectoral collaboration. As you know, we are the youngest member state of European Union, so all these steps that led us to AMR control and AMR reporting is still fresh, so I will also tell you about this, how we manage this, and how we get to the main aim to monitor antimicrobial resistance. So the first objective, so headlines, would be to impact the role of Ministry of Agriculture and Animal and Human Health Protection in the Republic of Croatia, then responsibility flowcharts and networking with EU agencies. So I saw earlier that all of you emailed to ECDC some flowcharts, who is doing what, who has some responsibility. So I would also like to show you how is it going on in Croatia. Then I would like to say something about laboratories that are accredited by Ministry of Agriculture, National Reference Laboratories, and EFSA, and European Reference Laboratory Coordination. It would be some things that you have heard earlier in the morning about EFSA and ECDC and EARSnet, so I just would pass through them. Then I would say about AMA data reporting from human sector and veterinary sector, antimicrobial consumption data reporting, and on the end it would be something about intersectoral coordination. So what's the role of our Ministry of Agriculture? So every year they published some measures of animal health protection and from parasitic and infectious diseases, and they are financing in 2019. This is the last one which was published in January. It's published at the beginning of every year, and it's published according to epidemiological situation in the country, so in Croatia and the surrounding countries. So the experts from Croatian Veterinary Institute, Veterinary Faculty, and Veterinary sector, employees, they are involved in these measures to make, and the most important is monitoring of animal important diseases and zoonosis like anthrax, avian influenza, West Nile fever, brucellosis, and so on. And a very big part of this is monitoring antimicrobial resistance. And all these measures are mostly financed through budget. Other three measures that also impact antimicrobial resistance is residue monitoring. So we have to monitor antimicrobials in a food, then feed monitoring plans that had to also some antimicrobials like fluorophenical, oxytetracycline, and thiazide has to be monitored, and food monitoring plan where very important these microbiologist criteria where we have gathered a lot of isolates for antimicrobial resistance on the end. So the network, how we have network in Croatia. So this is Ministry of Agriculture, but it's impossible to divide Ministry of Agriculture and Ministry of Health. So in the down corner you have some part of Ministry of Health. So we have Veterinary Department, Veterinary Public Health, Food and Feed Safety, which is dealing with sanitary inspection. So sanitary inspection, which is part of Public Health, and Ministry of Health has to give all information to Veterinary Public Health, which is coordinating with the RASAF system. So Veterinary Department is reporting consumption of antimicrobials. I will tell something about it later in details. And the Croatian Veterinary Institute as national reference laboratory for antimicrobial resistance is dealing with EFSA and reporting all the data to EFSA. If we take the same scheme for Ministry of Health, so we see that the most important coordination with European network is with ESACnet, it's ECDC, and its interdisciplinary section for antimicrobial resistant control, that's ISKRA. ISKRA is some intersectoral coordination in Croatia, so it will be something in detail on the end of this presentation. And State Institute for Public Health, their epidemiological unit, is also very good connected with ECDC because they identify record infectious diseases, identify epidemics, monitor trends in infectious diseases, and right now I think that they are obligated to monitor 99 diseases and to report them to ECDC. The third EU agency is ESNet, it's also under ECDC, and National Reference Laboratory also is obligated to give the data about antimicrobial resistance in humans. Very important is microbiological unit, which is part of Institute for Public Health, because they are part of project of joint action of antimicrobial resistance and healthcare associated infections in Croatia. That part is fight antimicrobial resistance, and they are working in working package 7, which is appropriate use of antimicrobials in healthcare. What about laboratories? So if you want to have objective data, the main aim is to have accredited laboratories and to establish national reference laboratories and official laboratories. So in 2010, Croatian government gave regulation on authorization of official and reference laboratories in veterinary field. And if you want to be national reference laboratory, you have to do something. So you have to have accreditation for ISO 7025, accreditation for the method you are performing, participation in interlaboratory testing, expertise of employees, and appropriate equipment. So, Croatian Veterinary Institute is the institute with the most NRLARs in Croatia. So we were established in 1901 as Royal Croatian and Slavonian Bacteriology Institute, and the most activities we are dealing is diagnostic and control of the infectious diseases, veterinary public health, and scientific activities. We are divided through Republic of Croatia. We are 5 departments, so we can cover all the territory of our republic, but the main center is in Zagreb. And as I told on the earlier slide, there are some things that you have to do prior to establishing national reference laboratories. We didn't have anything. So before 2006, we didn't have accreditation, either for ISO 7025, either for method. We didn't perform any interlaboratory testing. We didn't have appropriate equipment, and expertise of employees is under question mark, because if you didn't participate in any interlaboratory proficiency testing, you don't know your expertise. How are you, good or bad or some? So we started in accreditation in 2006, and it lasts until 2010. So we gives us some aims. First of all, it was reorganization, reconstruction. On the end, it was informatization, and all these steps led to accreditation. So in 2010, we succeeded to accreditate 173 methods, and in 2019, I think 210 methods. So I will just very fast skip by this because it's a little bit boring. So after accreditation, we were all bunched in the same building. We were doing like, there was no organization, just the laboratory in the Croatian Veterinary Institute. So we did some reorganization where we divided into 5 departments. So the 5th department is administration, so I didn't put it in this slide. So reconstruction is very important, because according to ISO 7025, you have to control your environmental in your laboratory. So you have to good temperature, good climate control, no wind. You shouldn't open your windows, and so I'll just show you how was before and how was after reconstruction. And the important is that all of this work were made by the funds of Croatian Veterinary Institute. So it wasn't any EU funds, so it can be done. And on the end, we have bought some equipment. So now we have accreditation. So now we can do a business. So this laboratory, which is part of Department of Microbiology, is getting. So first of all, we have to do some baseline studies, which European countries have made years before. So we decided to do, in coordination with Ministry of Agriculture, we decided to do baseline study, MRSA in pigs. So we were doing with 2010 and 2011. And we started to participate in EURL AR proficiency testing from 2009. In this year, it was possible to participate with this diffusion method. And we started with this diffusion method, but very soon in 2011, it was impossible to, because European Reference Laboratory told that this diffusion is not method we are dealing with, but with broad microdilution method. So in 2011, we started with broad microdilution method. So we participate in workshops from European Reference Laboratory from 2011. And we succeeded to accreditate this diffusion method, salmonella isolation and serotypization method in 2009. That was the first methods we succeeded to accreditate, and then broad microdilution method in 2013. So, what about European Reference Laboratory? When we started coordination with the European Reference Laboratory, They're organizing proficiency testing for Campylobacter, Salmonella, E. coli, and all these. What is important that all these proficiency testing are in correlation with EU Directive 2003-99. So National Reference Laboratory from Croatia is participating in this proficiency testing from 2009. So European Reference Laboratory annually organizes and participates in workshops. So we are participating from 2011. So it's very important to, it was years ago, so I think that Croatia became a member state in 2013. So we are dealing with 2011, so it was 2 years earlier. European Reference Laboratory disseminate knowledge on antimicrobial susceptibility testing methods. So everything is, you can take it from their website and just work through this. Profit-specific assistant, so we have some visit in Croatia in 2013, so where representatives from the European Reference Laboratory visited our National Reference Laboratory and give him, I don't know, I think was excellent, it was excellent chart in the laboratory, everything was fine. And provide confirmatory testing for national reference laboratories on bacterial isolates of particular relevance on required by the Commission. So every year EFSA, when receives some results, EFSA is calling European Reference Laboratory to retest some isolates to confirm that it is really okay. So what about data? We are obligated to give all our antimicrobial resistant data to EFSA. So we are doing it every year. EFSA have a mandate from European Commission that made some technical specification for harmonized monitoring and manuals for reporting zoonosis, zoonotic agents, and antimicrobial resistance. So on the end, when EFSA received data from national reference laboratories, on the end there is joint European Union summary report of antimicrobial resistance. These EFSA guidelines, which they are obligated to make, is of great help to policymakers. So all these guidelines are, you can see it on the EFSA website, and it's very great help when policymakers made their measures for preventing or reporting or anything else. So you don't have to think a lot. You have bacterial species, that. Animal population, everything is very clear, and it's great. So on the end, it's reporting. Reporting is the thing that Croatia had the biggest problem with, because we were not used to report on this way. So our main way was to make some Excel table and mail it to somebody who wants to see it. So in this reporting, EFSA wants all data in DCF format in their database data collection framework. So when you have some Excel tables or formats, you have to map them in EFSA way. So it would be acceptable for EFSA. And then you are putting it in DCF or data collection framework. There were a lot of problems with this, but I have to say that EFSA was of great help, especially Anka. I don't know if you met her. Anka is a great person which will help of anything you want to know about data reporting. So it's very important to communicate with EFSA all the time. What about Ministry of Ministry of Health and antimicrobial resistance? So this all data I got from Professor Tambic Andrašević. So she's working as a professor in the Ministry of Health in Croatia, and she's a leader of National Reference Laboratory for Antimicrobial Resistance in Croatia. So, as she told me, they have continuous antibiotic resistance surveillance from 1996, when it was founded Committee for Antibiotic Resistance Surveillance with the Public Health Collegium on Academy of Medical Sciences. They were gathering 20 informations for 25 labs, and I think that then was 31 existing microbiology labs in that time. Now it's 39. In 2002, international collaboration of the Croatian network was enlarged through establishing the Croatian chapter of the Alliance for the Prudent Use of Antibiotics. And also there was, in 2009, it was a national hygiene campaign. It was after our Minister of Health signed the WHO pledge regarding health-associated infection in 2009. 2010, on the recommendation of the ECDC, it was champagned targeting hospital antibiotic use. And 2012, it was nursing school, a course for physicians and nurses, 2 postgraduate education courses about multi-drug resistant microorganisms. So that's the whole information I got from my colleague from Ministry of Health. What about the National Reference Laboratory? So they were established in 2003 as National Reference Laboratory, and they're working in Zagreb University Hospital for Infection Disease, Dr. Fran Mihaljevic. They're collecting the AMA data, monitoring new resistant mechanisms, doing with education, standardization, interpretation, and external quality control. Also, they're actively involved in the European Committee for Antimicrobial Sensitivity Testing, EUCAS, then with EARS, it was EARS, now is EARS-NET. European Antibiotic Consumption Surveillance, ESAC, and they report all AMR state data to EARS-NET. So first data set they reported in 2013, and it was data for 2012 years. Antimicrobial consumption in veterinary medicine, we are reporting it, so in 2010, EMA started the ESFAC project. And 2018, this project will be managed in data of veterinary antimicrobials by animal species. So right now it's not by animal species. So first data Croatia reported was in 2014, and it was 2013 data. And subjects involved in drug selling in Croatia is wholesales and veterinary pharmacies. So if they want to do this job, they have to be registered and approved by Department of Agriculture, Veterinary and Food Safety. On their web page there is some Excel table which every year they have to fulfill, and this Excel table has 649 veterinary medicine approved for use in Croatia. And all these data are going to ESFAC, and on the end there is an annual report of EMA. In human medicine, it's a little bit problematic because there is, beyond wholesale, there is also pharmacies which can be public, hospital, and specialized retail, but also there is a consumption of very much drugs, medicines in hospitals. So all these data are put in a system of Croatian Academy of Medical Sciences, that's interdisciplinary section ISKRA, and they publish every year report of antimicrobial resistance in Croatia. So the last one was in 2017, so it was published in 2018. So they report this data to European Surveillance of Antimicrobial Consumption Network, and then on the end there is also an annual report of ECDC. Intersectoral coordination, I have to hurry up. So this is the main connection between Ministry of Agriculture, Ministry of Health, and Ministry of Science in Croatia. So their main task is to create a Croatian antibiotic resistance program by focusing on the antibiotic resistance, report the ministers about the results taken, and to survey antibiotic resistance and consumption survey, to facilitate rational antibiotic usage, and to strengthen cooperation between Ministry of Health, Ministry of Agriculture, and Ministry of Science. First, ISKRA published national program for AMR monitoring in 2009 from 2014, and the new one was published in 2015, and it's lasting till 2020 years. So all these scopes that we have to do is on website of ISKRA, and all these you know all of them because it's improve, protect health, monitor usage, increase awareness, preventing, controlling. So it's all the same as other European antimicrobial national programs. Actions that are taken that we are monitoring, you have seen it before. We are monitoring consumption also, so this was another scope that you saw. Promote responsible use of antimicrobial. So ISKRA published some guidelines for appropriate use of antimicrobials, mainly in hospitals. So it's urinary tract infections, surgeries, sore throat, MRSA treatment. So there's guidelines for AMR consumption and controlling the usage of antimicrobials. Another intersectoral coordination between Ministry of Agriculture and Ministry of Health is our national plan for official sampling, and it was published in 2015 and it's lasting until 2016. 2020. That's 5-year plan on official control. So we're defining actions, responsibilities, and reporting about official controls in Republic Croatia according to Regulation 82 from 2004 year. Another intersectoral cooperation is Croatian Agency Food and Agriculture. So it's working group on zoonosis formed in 2014 years. Where we are sitting in experts from Ministry of Agriculture and Ministry of Health, and we have a collaboration with all stakeholders involved in the monitoring, engaged in collecting, analyzing, publishing data about sources of detection, methods, zoonotics, antimicrobial resistance, conducting epidemiological research, information about diseases, prevention and suppression of, and international cooperation, and involvement in research programs. What about environmental? As probably in other European countries, it's not so in focus right now, and they are not involved in the work of Ministry of Agriculture or Ministry of Health, but we have right now 3 projects on Institute Ruđer Bošković, which are dealing with environmental antimicrobial resistance. So its impact of wastewater from pharmaceutical industry on antibiotic resistance of microbial communities in freshwater sediments. The other program is connection for environmental contamination with antibiotics and the development of resistance to antibiotic in humans. And the third one is biodegradation of macrolide antibiotic azithromycin and its impact on composition and structure of microbial community in wastewater buffers. So we don't, all these programs are lasting, I think, till 2020, so we don't have any results right now. Thank you for that.
Thank you very much indeed, Goran. And we can see that there's a great deal of work going on in Croatia. And sorry for having to ask you to hurry up a little bit, but we're running into our coffee break. One of the things that I wanted to mention was that for those who want to look in more detail at both the Croatian National Action Plan, but also the Norwegian and the Austrian and indeed others, there are links to them on the ECDC website under AMR strategies and action plans. Yes. So all those plans that you've heard about are there, the Norwegian one in both Norwegian and English, which is very nice. Are there any one point?
Are you aware of this online resources at ECDC, what we call Directory of Online Resources? That's where you have all the examples of a national action plan, examples of guidelines, etc.
Yeah. Are there any questions for Goran or points you want to raise? Doesn't seem to be the case. So now we're going to move on to coffee. Thank you very much, Goran. And we will, the time is 1:45. Can I suggest we come back here, we try and get back here at 3 o'clock?
that okay?
Is that okay?
Yeah, we say 3.
3 o'clock. We'll try and aim to get back here at 3 o'clock for the continuation of the third and last session. Thank you.